4, we just finished up the diencephalon derivatives, which were all those thalamuses, and we also did the brainstem. So we did the midbrain, the pons, and the medulla oblongata. We're now going to move into the cerebellum. So let's take a look at this mental map and see where we're at. So we did the cerebrum, we just did all those diencephalon derivatives, and then we did the brainstem. So the last thing we need to talk about is the cerebellum. So this is our cerebellum. This is our cerebellum. Okay. So the first thing that we'll do is, just like we did with the brainstem and the cortex, we want to identify the anatomical makeup, the structure of the cerebellum. So the anatomical composition of the cerebellum is similar to that of the cerebrum. So we have a gray cortex that's superficial to white matter. So let's make some comparisons between the cerebrum, the brainstem, or the spinal cord, and our cerebellum. So we have similar composition in both the cerebrum and the cerebellum, where we have gray matter on top of white matter. And for the basal, or for this brainstem, for the brainstem spinal cord, it's deep to the white matter. So I'll do, remember, it's just myelinated axons, so that's what I'm drawing it, is this yellow lipid. Okay, so now we have an idea about its composition. This white matter in the cerebellum has a specific name. It's called the arbor vitae. That's the white matter. And arbor means tree, vitae means life, so this is the tree of life. So this cerebellum is going to play a role in refining different types of contraction. So we always talk about refining skeletal muscle contraction, and that's the one we'll talk about with cerebellar processing. But it also plays a role in cognition, learning, problem solving. All right, so we want to do cerebellar processing. I'm going to draw out the picture first, and then we'll give some words to it. Okay. So if we draw our central sulcus, we know that we've got motor activity anterior to that and sensory activity posterior. So we're going to be talking about our motor cortex. All right, so we say that we want to send a signal to our hands to text with our fingers, right? So that's going to take some information from the premotor cortex and the cerebellum to do this fine skilled learning. So I don't know whether the signal comes from this association area or whether it goes from association area to primary motor cortex then down. But either way, from this motor activity, we're going to come down the brainstem and then over to our cerebellum. So our so in his notes, he has the motor association area, so maybe we'll do it from back here instead. Motor association area, the cortex sends the signal to the cerebellum, and we just saw it was through those conduction tracts of the brainstem. And it's going to send a signal that says that we want to do muscle contraction, this voluntary skeletal muscle contraction. So at the same time this message is coming, the cerebellum's always receiving, and we'll do it when we do those ascending pathways at the end. We have these spinocerebellar tracts. So from the spinal cord straight to the cerebellum, we have information coming. So instead of going from spinal cord all the way up to thalamus, then back down to the brainstem and over, we have some tracts that go straight from the spinal cord up to our cerebellum. And this is going to provide sensory information about proprioception, or stretch of our tendons and ligaments. And really, instead of stretch, I was saying stretch of ligaments and tendons, but this is really like, you're still getting signals from your ligaments and tendons and whatnot, but this is like position in space. But where you are in space is determined by how much your muscles are stretched and all that kind of stuff. So proprioception, equilibrium information, so like stuff about balance, which also you can think of that as are your muscles really tight to help you balance? Are they stretched out? So equilibrium receptors, proprioceptors, visual receptors. So let's say you want to type with your fingers and you're texting, you need to know with proprioceptors, you'll know that your hands are by your phone. Equilibrium receptors, maybe you're laying in your bed, so you don't have to think about your feet and whatnot. Your visual receptors are showing information like, okay, my fingers are this close to the keys on the keyboard, or this close to my fingers are this close to my phone for texting. So you're getting all this sensory information sent to the cerebellum. So before you take this action, you're getting sensory information so that whenever we say we're refining this muscle contraction, it's basically taking sensory information to decide what's the best way to do this motor activity. Because up here, this motor cortex just says, hey, I want to text, but it doesn't know how to text. So really this motor thing is just saying, I want skeletal muscle contraction. To have that specific, I want my fingers to type these letters, I need to get proprioception, equilibrium reception, visual reception, all this sensory information coming up to my cerebellum, where then I can integrate this message of, hey, I want to do this action. Hey, here's where I am in the world. Here's my balance and whatnot. Here's some things that are visually going on around me. Now that I have this information, I can decide what's the best way to text, or what's the best way to do an agility course, whatever you want to say, whatever motor activity that you're doing, whatever skeletal motor, whatever voluntary motor activity you're doing. All those things mean the same thing. So we'll take that signal from the cerebellum back up to the cerebrum, and then from the cortex, from that motor cortex, we can send the signal back down the brainstem, down the spinal cord, out through a motor neuron. So let's give some more words to that. We're just going to say the motor cortex. He had the association motor cortex. The motor cortex sends a signal. And let me write some stuff up and we'll talk. Alright, so our motor cortex sends the signal to the cerebellum, and at the same time, through these ascending spinocerebellar tracts, we're getting the sensory information about visual, equilibrium, proprioception. That's all going to our cerebellum. Our cerebellum is integrating this information it's getting from all these different receptors in our body. It's integrating that sensory information to produce the best, most desired motor output. So again, the cerebellum will send that signal to the cerebrum, and then in the cerebral cortex will send from that motor area, that motor cortex will send a signal to the effector organ, in this case skeletal muscle. I looked up some stuff on the internet about proprioception, so let me just read this. What's an example of proprioception? For example, proprioception enables a person to close their eyes and touch their nose with their index finger. Other examples of proprioception include knowing whether the feet are on soft grass or hard cement without even looking, even while wearing shoes, balancing on one leg. So that's what we mean when we're talking about position in space. You know whether you're on grass versus hard cement because of these proprioceptors. So it's allowing you to know where you are in space and what you're interacting with. All right. Cool. So that's the cerebellum.